Hi there, I'm Sonal Mehrotra Kapoor. You're watching me on NDTV. Now, as the country goes into a dire situation of hospital beds running out, a lot of doctors are now prescribing people to stay at home and take care of COVID at home. Now, it is important to understand that not everybody needs hospitalization if you have COVID. A lot of treatment and good treatment can happen at home. So we thought let's bring you some good home care tips for COVID-19. If you've contracted the virus, if you have somebody in the family who's contracted the virus, what are the few quick things that you can keep in mind and that are essential to follow? Number one, isolate. That is absolutely necessary. In your house, if you have anybody who has tested positive, in fact, even if the result is not out, even if you have tested COVID negative, if you are showing symptoms, you have to isolate. So if you have symptoms like fever, you have cough, you have sore throat, you have muscle pain, nausea, diarrhea, loss of smell and taste, and even if you have discoloration in your nails and hands, then this is a good indicator that you have contracted the virus, even if you're testing RT-PCR negative. We've discussed that in our previous video as well. In that case, first up, isolate yourself. If you only have these symptoms and you do not have shortness of breath, then that means you're a mild patient. And mild patients can completely recover at home. If you start reporting shortness of breath, that's when the situation gets a little serious and you should get in touch with your doctor and he will decide if you have to go to a hospital or if you can get an oxygen concentrator at home. Next, you have to ensure that you're fully equipped. That means you have to have an oximeter and you have to have a thermometer inside the house. Best thing to do is make a chart for yourself. Take your temperature and your oximeter readings at least twice a day. Tabulate that, put that on a piece of paper and share that with your doctor. You need to have a physician looking into all your symptoms, even if you are at home. Share those details with him. He will obviously put you on a medication. Follow that up. But there are a couple of other tips that a lot of times doctors forget to tell. So we thought we'll bring that for you. Some tips like drinking lots of fluids, absolutely necessary if you are COVID positive. Steam inhalation, extremely important. Warm gargles have proved to be very good. Also, washing your hands with soap or sanitizer frequently. The thing to remember is that if you are COVID positive at home, or say you have a family member who's positive and he or she is isolated in one particular room, ensure that there is only one person in the family who's the caregiver, meaning one designated person who double masks and is the one giving him food all the time. The thing to remember here is that your linens, your utensils should not be exchanged. Everything that is there inside the room of the isolated person should not be mixing up with the rest of the family members. It will lead to further spread. So these are the things that you need to keep in mind. But very importantly, there are some red flags as well, meaning if you report the following things that I'm going to tell you now, you must immediately tell your doctor. Like the minute you notice a dip in your oxygen levels, if your oximeter says that your oxygen concentration is below 92%, then contact your doctor immediately. If you have slurred speech, tell your doctor. If you have weakness in your limbs, which is beyond what you were experiencing earlier. If you have acute pain as a headache, if you have difficulty in breathing, and if you feel a chest pain as well, if you feel there's pressure on your chest, mostly on your heart is where you're feeling the pain. And if you have sort of bluish discoloration on your lips and on your face, immediately contact your doctor. He'll tell you what to do. A lot of people also are asking us that should we then just rush for a CT scan? No. CT scan is something that is to be required at different stages with different people. Let your doctor decide when you need a CT scan. In fact, what you need to get done before rushing in for a CT scan is some simple blood test reports, like a D-dimer, etc. Again, we've done a video on this earlier that you can go to and get more tips on. Those blood tests are a good giveaway to your doctor on whether or not there is inflammation in your body, and that should tell them how to follow the line of treatment. The thing to remember is do not panic if you get COVID. Yes, we are in the middle of a massive healthcare crisis. Hospital beds are running out, oxygen is running out, the medical infrastructure is completely overburdened. The onus is on you to keep yourself safe. That's number one. And even despite that, if you get the virus, start by following some of these symptoms, following some of these tips over here. Get in touch with the doctor. Don't be in a sudden rush to get to a hospital. One more thing before I forget. A lot of people ask us that people who have comorbidities or pregnant women, do they need to rush to the hospital immediately? The answer to that is no. Mostly no. If you have comorbidities like you have diabetes, you have heart issue, you are a pregnant woman and you contract the virus, tell your doctor. He will tell you even these patients can recover if you don't have a very severe form of infection at home. Hope these tips are handy and helpful. Keep this in mind. Keep yourself safe.